Hello, 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 Facebook. I am Dr. Myla Bennett of Ederra Plastic Surgery and Medical Spa, and I am coming to you today to talk about a subject that is a very passionate topic for me. I want to first start off by saying that this is by no means a commercial for me or my practice. This is basically a type of public service announcement. I, over the last several months, have been interacting with a lot of different women who, on social media and in person, about plastic surgery and specifically plastic surgery abroad. But this Facebook Live is about a little bit more than plastic surgery abroad. It's actually because the problem doesn't just happen abroad, it actually happens in the United States as well. And so this is really just about how to choose safely when trying to get plastic surgery. So this morning, yesterday, I actually spent half of my day helping a lady who had gotten surgery in Colombia in December, like a month ago. And she was disfigured and she was left with draining wounds and dead tissue and all kind of stuff, and back in the United States, and nobody would help her. And normally, the policy in my office is that I don't usually see patients when they're freshly post-op from another surgeon, whether they're from the United States or whether they had surgery in the United States or somewhere else. But in this particular situation, I decided to go ahead and see her, and I'm glad I did. I consider her a friend now, and I'm, going to help her to her journey for healing. But the whole situation has really opened my eyes to the fact that I think part of the reason why God called me to be a plastic surgeon is to help shine light on this very dangerous issue. Because the reason why a lot of women go to certain places, and when I say places, I'm not talking about a particular country, because there's places in the United States that are just as dangerous, is because of the financial benefit of going to certain places. And then for a lot of the women, it's not necessarily a financial thing. Sometimes they just want the type of body that these doctors create. And so my plea is for you guys to hear me. Don't think about this as me trying to get patients, because I'm not. I actually don't really do Brazilian butt lifts. I don't really like them. So that's not my goal at all. To get a bunch of people to come to me for a BBL, that's not at all my goal. My goal is that if that's what you desire and you want to look that way, that you wake up from it and you get to actually enjoy the body, and not be somewhere in an ICU or in a casket because somebody said they would do aggressive lipo, or somebody said they would do it cheaper, or somebody said they would do all the stuff that you think you need in one surgery when really maybe it should be 2 or 3 surgeries. And I want you to be equipped to do research that actually is effective. Over the past year, one of the phrases that tends to drive me up a wall is when people say, I did my research, because most of the time when they think they've done research, it really isn't research at all, but they don't know any better. There's no way for you to know that unless somebody explains to you how to properly research for a plastic surgeon that does cosmetic surgery. My argument to you is that your sole source of choosing a surgeon shouldn't be Real Self, and it shouldn't be these groups on Instagram and Facebook and wherever else these groups are. And it shouldn't be solely from before and after pictures. The first thing that I think you should do before you do any of that stuff, and I didn't say you can't do those things, but that shouldn't be how you base your, that shouldn't be how you decide if you're going to choose a surgeon. The first thing you should do is find out if they are a real plastic surgeon. A plastic surgeon. Not a cosmetic surgeon. A plastic surgeon. One way that you can know for sure that they are a plastic surgeon is to go to the American Board of Plastic Surgery website and type their name into the search. And if it doesn't come up, they're at the very least, they're not a board certified plastic surgeon. They still may be a plastic surgeon. They might not have been board certified yet. The board certification process for plastic surgery is a rigorous, lengthy one. It takes like about a year and a half to get board certified in plastic surgery once you're done with all of your training. So, but if you don't see them on that site, if somebody you're thinking about getting cosmetic plastic surgery from, you don't see on that site, maybe you should start thinking about one of the other people you were considering for plastic surgery. Now, sometimes doctors will say they're board certified by the American Board of Cosmetic Surgery. That is not a board that is recognized by, that's not a real board. That's one that some people just made up. It's not like recognized by the governing body over all the doctors. That's not a recognized board, and almost any doctor can get into that board, whether they're qualified to do cosmetic surgery or not. And it's actually probably, I'm not sure who created it, but my hunch is that it was created by somebody who couldn't be board certified in plastic surgery, and that's a way for them to be able to say they're board certified when you ask them the question. When you say, are you board certified? They can say, yes, I'm a board certified cosmetic surgeon. It's a fake board. It's crap. So that is not, I'm not going to waste my money or energy getting board certified by that board, because I'm a board certified plastic surgeon. So there's no point in me doing that, right? I used to think you could go onto a doctor's website and figure out if a plastic surgeon is, if the doctor is a real plastic surgeon. But in the last few months, I found a few doctors that I know for a fact aren't surgeons at all, and they literally just bold-faced lie on their website and say board certified plastic surgeon, like literally just lie. So if a person is that, first of all, if they're not even honest about their title, you shouldn't trust them with your body and your life. If they are tricking you into believing that they're one thing and they're something totally different, that should make you question their ethics and morals and whether or not you should entrust your life with them. There is no body shape. There's nobody that is worth dying over. It's just not. So if you're dealing with a person who's so fake that they won't even tell you what kind of doctor they really are, or if you're on their page and you can't figure out what they trained in, that's a sign that you should go somewhere else. And then people will say, well, like my friend got their body done by so-and-so, so-and-so, and it came out good. So, I did my research and I had a couple friends who went to them and they were cool. Okay, so your friends got away. Like they definitely, I'm not saying every single person they touch is going to end up dead or in the ICU. But if like a third of them or half of them, or some unreasonable number of people die or have major complications, then that means you're just basically playing Russian roulette. So they might knock it out the park on you, or they might kill you. Like, I don't think it's worth laying down if you know that you actually have a real chance at not waking up, just so that your waist can be small and your butt can be big. Which, by the way, I personally think the Brazilian butt lift is a Jerry curl of 2016, 2017. It's already, I already see many ladies come in and ask me if I can make their butt smaller. Like, it's a fad. It's not, people aren't going to still be doing this in 2 years. Like, it's already on a downswing. So now you have risked your life to get something that's not even something that people will even really like in a few years. It just doesn't make any sense. If you're seeing, it's kind of sad because people, just today, so a person, this page that I'm a member of, they posted the results, some really bad complications from this one patient. And then there were people on there who were like blaming the patient. Well, she should have made sure she was healthy enough to get surgery. That's not her job to make sure she's healthy enough to get surgery. Your only job when you come to me is to be honest when I ask you questions, as I am trying to figure out if you're healthy enough to get surgery. You're not a doctor. You don't know that. You don't know anything about surgery. You don't know anything about physiology and what happens in healing. You don't know anything about any of that stuff. So to blame the patient saying she should have known that if she was healthy enough to get surgery is absurd. Like, if the doctor didn't take the energy to figure out if this person was healthy enough for surgery, that's the doctor's fault. That's why we spend so many years training. My training, I did 10 years of school after high school. Then I did a 5-year residency in general surgery and plastic surgery. And then I did a 1-year fellowship. So after I graduated from medical school, I had 6 years of operating every single day. You know why they call it residency? Because we're practically living in the hospital. You never leave. You just operate all day long, every day. I went weeks sometimes where I worked 7 days a week and I was operating 7 days a week. So then how can you expect somebody who has no training at all to be able to decide if a person is safe to get a surgery or not? It was ridiculous. Like, to go and blame, I'm not saying that patients can't do things to cause complications. Absolutely they can. But to go and say the person should have known if she was healthy enough to get surgery, that's the doctor's fault if the person's not healthy enough to get surgery. If they don't take the time to figure out if a person is a good candidate, that's the doctor's fault. It's the patient's fault if the patient lies about their medical history to the doctor. Now that could be the patient's fault if you're not honest, because the doctor's not psychic. But I think this issue is a doctor and a patient issue, because patients will knowingly go to doctors who are popular, even though they know they have these horrific complications, because they did some of them really, really well, and then they just ignore the people that they kill, they ignore the people that they disfigure, they ignore the people that they hurt, they ignore all that, and they just focus on the people that they did a good job on, a physical good job on, which I even with some of those, I even argue whether or not that's really a good job. Because if you are knowingly taking a risk, like a unreasonable risk, to do super aggressive lipo on somebody and go and shove multiple liters of fat into one area, knowing, or maybe they don't know because maybe they weren't really even trained in it, but knowing full well that if I go and put 2 liters of fat in one butt cheek, there's a high complication, there's a high risk that a lot of that fat's gonna die. And guess what happens when the fat dies? You create these big cysts, they get infected, you get draining sinuses, then that's when you end up, it needs, all tissue, all cells need blood supply. So if you go, the fat is living on no blood supply for about 3 weeks. Is living on the blood supply of the tissues that are intact around it. So if you go and put a big old glob of fat, and the closest blood vessel is where the top of my fingers are and down where my thumb is, all of this in the middle has no blood supply. Guess what? It's gonna die. So that's how you end up with getting these oil cysts and these draining sinus tracts and these hard spots and all of that stuff. That to me is unacceptable, because a trained plastic surgeon knows that you can't go and put 2 liters in one plane and think it's going to all live. In fact, most of it is going to die. So then you go and you start putting it into multiple layers, and the reason why doctors do that is so that if you're putting it in different layers and you got blood, it's like a 7-layer cake. If you're putting it in all these layers, let's say the icing is the blood vessel layer. So then you got cake and then some icing, then cake and then so you got fat and then blood vessel, fat and then blood vessel, fat and then blood vessel. Well, then the fat can live that way, right? But then what happens when untrained cosmetic surgeons hear, oh, if I put it in more planes, then the fat will live. So then they start going deeper and deeper and deeper, and then you start hearing about paralysis. So I saw that this morning and it made my blood boil. Someone